Well, with me today from Harvard Eye Associates is Dr. Brian Kim. I'd like to welcome you back. Always good to see you folks.
Oh, thank you so much for having me back.
And today, an interesting subject that has to do with cataract surgery, and this is retina problems that could occur. And I guess when people have cataract surgery, a lot of times they're thinking, okay, I think my vision is going to be fantastic, and it certainly is improved, but there can be some issues as well, right?
That's right, and this isn't meant to be any sort of scary or off-putting kind of talk today. In fact, I had two other titles for this segment, and that was, well, why is my vision still blurry after cataract surgery? Or, my friend didn't need glasses, why do I need glasses after cataract surgery? And it's, most of the time, cataract surgery, as I'm sure you're aware, it goes very well, and most people do notice a significant improvement, but there are a lot of other things and a lot of other considerations that we have to understand about cataract surgery. And that is primarily that cataracts are not the only thing that can affect vision. And oftentimes we just forget that as people, as doctors and patients. And this kind of all goes back to thinking of the eye as a camera. So just as you would use a camera, if you're getting a blurry picture and something that's out of focus, we just have to think, well, why is it getting out of focus? And that can be from, well, maybe there's a scratch on the cover, or the lens is a little bit dirty, or maybe it's not quite in focus, or maybe there's something wrong with the film in the camera. So there are lots of different places, and there are lots of moving parts here. And so, cataract surgery isn't always the end-all, be-all for people's vision problems. So today, I wanted to primarily focus on more of the inner inside of the eye, the retina in the back of the eye, because that tends to be a little bit more invisible to people. It's something that's not necessarily a tangible fact or a tangible component. I think, but we get a lot of, oftentimes we'll see a lot of people come in just a little bit frustrated, and I think a lot of it comes from expectations with cataract surgery.
Right, and is this something that you folks can determine ahead of time? Do you look at the, you're looking at the whole package, so to speak? Like it's probably obvious, okay, they need cataract surgery, but there's other things that can be going on as well.
Yeah, and I think from taking the patient's perspective, and you think, oh, yep, I have a cataract and I need surgery. And when you're told you need surgery, I think the mind typically wants to go to, well, I need surgery, and you forget and block out everything else. But I think it's, the take-home message here, which we'll see at the my very end, is just try, and we want to make sure that we're aware of the whole condition of the eye to see what we should expect with our cataract surgery. So, even the cataract surgery, if it goes perfectly, we can still end up with a little bit of a blurry vision. And most of the time, when we manage these kinds of concerns after surgery, are oftentimes things that we knew ahead of time, but it was just maybe either a misunderstanding or a miscommunication. So, my take-home point today for this entire thing is just walk in knowing what to expect and have an understanding of the entire condition of your eye as a whole.
Okay. So in this next slide, we're going to look at floaters. Now, first explain what a floater is. Everyone gets those, even if your vision is great, you do get them.
That's right, yeah. It's typically an age-related finding that we see. The gel inside of the eye just starts to become a little bit more mobile with age. And cataract surgery can sometimes make that a little bit more mobile as well. But oftentimes, people really notice them a lot more after cataract surgery. Well, because we've cleared up the vision a whole lot better and improved that vision so much that now you can actually see them.
Wow.
And sometimes people just get very annoyed by this new visual phenomenon that it can sometimes be a little off-putting or unnerving, yet it was there pre-existing. And it's not something that necessarily, even the doctors we can't see them very well either, so we don't know what to expect necessarily.
Okay, so, what causes them? Because throughout my life, every once in a while you get them. Even when I was young, in fact, I remember many, many years ago going up to a science center in San Francisco, and I forget when this was, but probably in the early 1980s or something like that. And one of the exhibits was about floaters.
Yes.
And I remember my friends and I were all like, yeah, we get those. We always wondered what those were. And it explained what it was.
Yes.
So it's not unusual for somebody 20 years old to have floaters on occasion.
Oh, you're absolutely correct. Yeah, it's the proteins within the eye that just start to, they become a little bit more apparent and they start to liquefy as we get older. So some people start seeing them at age 20, but the typical age is really around the age between 50 and 70. We tend to see a lot larger floaters or more numerous ones.
Okay.
So now with cataract surgery, we still want to investigate that. If people notice them after surgery, most of the time it tends to be that they're just more visible. But they can be things like we've talked in the past. They can be the early indication that people might have a retinal tear or a retinal detachment or something unwanted or unexpected as a side effect of cataract surgery. Now that's not common. Don't get me wrong, but and certainly nothing to to deter surgery for most people. But it is something that we want to be aware of.
Right.
And in the rarest cases, it can be a sign of infection. Sometimes we actually see the white blood cells trying to fight off an early infection, so to speak, and so we always want to evaluate new floaters after cataract surgery. But I'd say the most of the time it was probably something that's there to begin with.
And just now you're noticing
and now
it
you're
a little
just
more.
noticing it.
The next slide, pre-existing retinal conditions, and of course this is something again that it goes back to communication, where
exactly
the patient understands, well, yes, you do need cataract surgery. However, it's not going to be the end all for everything and get you perfectly clear vision.
Right, and I'd say most of the time we understand and we know what to expect and we can see the retina well enough. But when you can't see out of your eyes, we also can't see into your eyes either. So it's it's sort of a cloudy lens inside the eye. So oftentimes the cataract is just so bad that we cannot even accurately tell what's going on, and we don't know until after cataract surgery. Of course, we do have instrumentation that helps us to better predict that, but yeah, there's an occasional time where we just don't know.
Oh, I didn't realize that.
Altogether.
Okay.
So that does impact. If we don't know what we're getting into necessarily, sometimes the doctor will have to make recommendations more conservatively as far as what lens implants or how aggressive, what type of surgery we actually want to do. Should you pay money for this surgery, or should you enhance your surgery, or should you just kind of sit back and just wait and see what happens and enhance that later on.
And that's an option?
That's an option,
be done later?
Sure, absolutely.
All right. So the pre-existing retinal conditions, macular pucker and degeneration, and also diabetes.
And also diabetes is a factor too. Sure, certain things can oftentimes can be pre-existing that are very subtle changes on exam, or it's something that it's very difficult to detect, but can affect your vision after surgery, yet we're there the whole time. Okay.
And macular edema.
So this is one of the more common things, and this is a side effect of just having surgery itself. If we have surgery anywhere in the body, we expect inflammation and swelling, but in the eye it can create swelling in the retina itself and can blur your vision. And for the most part, it has a very good prognosis and something that we can treat with drops or medications alone. But yeah, we want to be aware that yes, some people just require a little extra healing time, which is, when we think about it in that way, it tends to make sense.
And again, when you go in for this, or really anything, is I think the best thing for patients anyway is if you're experiencing a problem beyond, or you feel you are, it's communication back and forth. And for you folks to communicate back, okay, here are some things that could be the possibilities here.
That's absolutely right. We encourage the patient to be engaging and proactive and ask about other possible conditions. And we want to, sometimes after you've got all your questions asked about surgery, we want to say, well, are there any other considerations, or is there anything else that I should know about my eye? Just to kind of bring it back and let's take that step back and just get the whole picture of my eye, so that we all know what to expect from surgery. Yeah.
And I know you've talked about this before, and so is some of the other doctors, that cataract surgery is now, it's getting to the point that when people have a LASIK surgery, if they get to a certain age, they may reconsider and just wait because a good chance they may have cataract surgery later. And can't LASIK surgery kind of interact 5, 6, 7 years down the road.
It certainly can. It can interact, and oftentimes we can often get the same results that LASIK surgery would with cataract surgery these days. So in many people. So yeah, it is something to strongly consider, and certainly talk to your eye doctor about before doing that. But
all right.
Yeah, it is Macular Degeneration Awareness Month once again, and we have our our monthly seminar that we've been doing for several years. So we'll be talking about macular degeneration again at the end of the month. And
and people are just invited to show up, or should they call first? Do they need to?
Please call. Yeah.
Okay. Because you have a limited space, right?
We do have limited space.
Okay.
But it is open to the public, and anybody who would like to attend, sure, it's open.
Okay.
So we invite everybody to come.
So that's going to be on February 26th at 5:30. Don't know what day of the week that is?
That's a Tuesday.
Tuesday,
yes.
okay. And 951-2020 is the number. Or you can email them at, you can see there, Christine M. at harvardeye.com. If you forget that for some reason, you can contact us here, because we are in contact with Christine quite often, so we can pass along her email to you as well.
Well, thank you so much, Ken.
All right. Doctor, good to see you. Say hi to everyone for me.
Will do. Thank you so much.
All right, take care. We'll be right back.